You were just sitting on your couch, right? Everything is perfectly fine.
Just a normal evening.
Exactly.
Yeah.
And then your dog makes a sound you have literally never heard before.
Oh, I know that sound.
Right. And in a fraction of a second, your heart just completely drops into your stomach.
Mm.
And you're suddenly faced with this, like, ultimate pet owner dilemma. Do I just keep a close eye on this, or do we need to speed to the emergency vet right now?
It is, honestly, it's a terrifying moment.
Mm.
Because they can't just tell us what hurts.
Yeah.
They can't point to a specific spot. So we are basically forced to become medical detectives on the fly, and we're doing it entirely running on adrenaline.
Exactly. And, we are so glad you're joining us for this deep dive today, because we are pulling from this remarkably detailed transcript from the Dog Health Academy.
It's a great source. Really thorough.
It really is. And our mission today is simple but massive. We are going to decode the critical life-saving difference between a minor pet hiccup and a true medical emergency.
Which is, arguably the most vital distinction any dog owner will ever have to make.
100%. And I want to promise you right out of the gate, this is not going to be like some terrifying, anxiety-inducing lecture.
No, not at all. We don't want you locking your dog in a padded room.
Right. The whole vibe today is really about empowerment. Okay, let's unpack this.
Yeah.
Because the ultimate goal of today's deep dive is to shortcut that late-night panic, stop the frantic internet spiraling, and give you a crystal clear mental checklist.
And to get to that level of empowerment, we really have to start by establishing a medical baseline.
Right.
The Academy's material lays out a really helpful framework. They call it the spectrum of care. And understanding this spectrum, it completely changes how you react.
How so?
Well, on one side, you have urgent situations. These are things that are definitely concerning, but, they do not require you to blow through red lights on your way to a clinic at 2 in the morning.
Okay, so we're talking about things like a small cut that isn't bleeding too heavily, or maybe mild limping after a run.
Exactly. Or like a basic upset stomach where they threw up once, but they're still wagging their tail.
Right, they're still acting like themselves.
Precisely. Your primary vet definitely needs to hear about those things, but it can usually wait for a regular appointment or just a same-day phone call. It's an issue, but the dog's vital systems are stable.
Okay, that makes sense.
But then, on the absolute other end of the spectrum, you have true emergencies. These are the situations where waiting even a few hours, or sometimes just a few minutes, could quite literally cost your dog their life.
And that brings us to this obviously brilliant analogy from the material. Learning the signs of a true emergency is exactly like knowing where the fire extinguisher is before there is a fire.
That's the perfect way to look at it.
Yeah, because you pray you never, ever have to use it.
Yeah.
But if a grease fire suddenly breaks out on your stove, you do not want to be standing there frantically Googling, how to put out a grease fire.
No, you definitely don't have time for that.
Right. You just want to reach blindly and grab the extinguisher. But I do have to push back a little bit here.
Okay, go for it.
Isn't literally any weird symptom in your dog totally panic-inducing? Like, how do we actually define that hard scientific line between I should keep an eye on this and we need to get in the car right this second?
It is the most common question veterinarians get, hands down. And the answer really comes down to this physiological concept known as the golden hour.
The golden hour.
Yes. So in true emergencies, like a twisted stomach or severe poisoning, which we will definitely break down shortly, the golden hour is that critical window of time immediately following an event where medical treatment is vastly more effective.
Okay, and why is that hour so crucial?
Because the reason is entirely cellular. When a severe trauma occurs, the body's systems just begin to cascade and fail.
Oh, wow.
Yeah, so with every passing hour, the survival rate plummets and irreversible organ damage increases. The organs are essentially being starved of what they need to function.
That is terrifying.
It is. So the line between urgent and emergency is drawn by time. Acting fast is literally the only thing standing between a full recovery and a completely devastating outcome.
Right, because their bodies are just deteriorating by the minute, and you can't always see it on the outside.
Exactly. And since that entire golden hour relies completely on oxygenated blood effectively reaching and feeding the dog's organs, let's look at what happens when that specific system visibly begins to fail.
Let's do it. Let's talk about the oxygen crisis.
Yeah.
So, breathing, it seems obvious, right? You look to see if the dog is breathing. But what are the actual red flags we should be looking for?
Well, healthy dogs breathe smoothly, quietly, and mostly through their noses when they're at rest. So the primary red flags are excessively fast, labored breathing, or making this really harsh wheezing or honking noise.
Right.
But the absolute most crucial visual cue is their gums.
Their gums, really.
Yes. Healthy gums should be bubblegum pink. That pink color tells you that rich oxygenated blood is flowing all the way to the
Oh,
extremities.
I see. Which means if you lift their lip and those gums look, what, pale or white?
Pale white, or if they have a bluish tint, that is a massive immediate alarm bell. That means the oxygen simply isn't circulating.
Wow.
It is one of the most reliable indicators of a crisis. And you also really need to read their body language. A dog struggling for oxygen won't just sit there calmly.
Right. The data actually notes they might have their sides heavily heaving, or they'll physically stretch their neck out and lock their elbows just to create a straight line to get air into their lungs.
Yes, the orthopneic stance, it's a clear sign of distress.
And there's also this general inability to settle down, right? They keep getting up, circling, lying down, getting up again.
Exactly. If they are frantically shifting positions while struggling to breathe, they are in profound distress. And closely related to oxygen failure is collapse, or a total loss of consciousness.
Which has to be one of the scariest things to witness.
It really is. If your dog suddenly goes limp, cannot stand up, and is entirely unrousable, you are dealing with a severe, immediate emergency.
And a collapse could be caused by a whole host of invisible internal issues, right?
Huh?
Like undetected heart problems, or dangerously low blood sugar, or massive neurological events.
Yes. And the key takeaway here is you cannot diagnose a collapse at home. Don't sit there and try to figure out why they fell over.
Just move.
Exactly. Get them to the clinic. Which actually brings us to one of the most visually terrifying neurological events an owner can ever witness: a seizure.
Oh man, yeah. If you have never seen a dog have a full-blown seizure, it is incredibly jarring.
It's very violent.
It is. They might suddenly fall over, stiffen up completely, paddle their legs like they're running on their side, and they very often lose total control of their bladder or bowels.
It is deeply traumatic to watch your best friend go through that.
It really is. And I actually want to bring up a piece of folk wisdom here,
Hmm.
because I've always heard that if a human or a dog is having a seizure, you should try to grab their tongue so they don't swallow it and choke.
Oh, man. I am so glad you brought that up because we need to aggressively debunk that myth right now.
Oh, really?
Yes. The veterinary consensus is absolute on this point. Do not put your hands anywhere near your dog's mouth during a seizure.
Because they aren't actually going to swallow their tongue.
Right. It is anatomically impossible for them to swallow their tongue.
Good to know.
But what will happen, almost guaranteed, is you will get severely bitten.
Oh, wow.
A dog in a seizure is experiencing this massive electrical storm in their brain. They have zero control over their jaw muscles, which are incredibly powerful. They will clamp down on your hand, and they simply won't be able to let go.
That is terrifying. So what is the actual correct protocol when the paddling and convulsing starts?
Your job is to manage the environment, not the dog.
Okay.
First, clear the physical space, shove the coffee table out of the way, lock the top of the stairs, pull them away from anything they could hit their head on.
Got it.
Second, keep your own voice extremely calm. And third, and this is vital, time it.
Like, look at your watch immediately.
Yes, this is a critical data point for the vet. A seizure lasting 1 to 2 minutes feels like an absolute eternity, but it is typical.
Okay, so what's the danger zone?
Any seizure that lasts longer than 5 minutes enters a state called status epilepticus. That is a full-blown emergency because the brain essentially begins to overheat, which can cause permanent damage. You need to head to the clinic immediately if it hits that 5-minute mark.
And what happens when the seizure finally stops? Because, I mean, they don't just pop up and ask for a treat, right?
No, not at all. They enter what neurologists call the post-ictal phase.
Post-ictal phase.
Right. After that electrical storm, the brain is just exhausted.
Yeah.
Dogs will often seem incredibly dazed, completely confused, or they might even be temporarily blind.
Wait, blind.
Yeah, temporary blindness is common. They might bump into walls or pace restlessly. And even if they seem to slowly bounce back and act completely fine a few hours later, they still need to be evaluated by a vet, especially if it was their very first seizure.
Okay, so those are the highly visible crises,
Yeah.
right? The labored breathing, the collapsing, the physical convulsions. But we need to shift our focus to what happens when the emergency is completely invisible.
Right, the hidden dangers.
Because the material we're looking at highlights some really insidious threats that happen entirely out of sight deep inside the dog's body.
Internal bleeding is a prime example of this.
Yeah.
You obviously can't see the blood leaving the vessels, but you can see the secondary signs. The blood has to go somewhere, so you are looking for a suddenly swollen or very tight abdomen.
Okay.
You're also looking for those pale or white gums again and extreme lethargic weakness. This is especially critical to watch for if your dog has experienced any kind of blunt trauma, like maybe a rough fall at the dog park.
And that swollen abdomen actually leads right into something that is an absolute nightmare for dog owners: bloat.
Oh, yes. The clinical term is gastric dilatation-volvulus, or GDV.
Okay, GDV.
And what's fascinating here, clinically speaking, is the mechanical physics of this condition. The dog's stomach rapidly fills with gas. That's the dilatation part.
Right.
But then the stomach actually twists on its
This
axis.
flips completely over like a hammock spinning around.
Exactly. It physically twists, which completely seals off both the entry from the esophagus and the exit to the intestines.
Oh, that sounds awful.
It is. It traps all that expanding gas inside. And worse, it pinches off the major blood vessels supplying the stomach and surrounding organs, including the spleen.
And this is mostly in big dogs, right?
Mostly, yes. It is most commonly seen in large, deep-chested breeds. We're talking Great Danes, German Shepherds, Standard Poodles, Weimaraners, because their chest cavity gives the stomach room to swing. Though I should note, any dog can technically be affected.
And because it's completely twisted shut, the outward symptoms are incredibly specific.
Very specific. The hallmark signs are a visibly distended belly. It might even look tight and sound hollow, like a drum if you tap it.
Wow.
The dog will be pacing, extremely restless, drooling heavily because they are incredibly nauseous, and often they'll be looking back at their own belly in distress.
But the most crucial sign, the absolute red alert, is unproductive retching. Like, they keep trying to throw up, they are heaving with all their might, but literally nothing comes out.
Because the stomach is sealed shut, nothing can come out. The veterinary experts explicitly call this specific combination of symptoms a 9/11 for dogs moment.
That is so scary.
GDV is fatal within hours, sometimes less, and the only fix is immediate emergency surgery to untwist the stomach. Every single minute matters.
That is just incredibly scary. And, another invisible enemy is toxins. Dogs explore the world with their mouths. They eat everything.
They really do.
The usual suspects are pretty well known, right? Certain houseplants, rodent poisons, chocolate. But there are a couple of really sneaky ones. Grapes and raisins, for instance.
Grapes and raisins are terrifying because the toxic dose is completely unpredictable.
What do you mean?
Well, one dog might eat a huge handful and just get an upset stomach, while another dog might eat a single grape and go into acute, fatal kidney failure. There's just no safe amount.
Wow. And the other major hidden toxin is xylitol.
Oh, xylitol is incredibly dangerous. It's an artificial sweetener found in a ton of sugar-free products. Gum, mints, baked goods, and most notably, certain brands of peanut butter.
Which people buy specifically to stuff into their dog's puzzle toys.
Exactly.
And here's the mechanism that absolutely blew my mind from the research. In humans, xylitol is completely harmless. But a dog's pancreas literally gets tricked. It confuses this artificial sweetener with actual sugar, and it just dumps a massive, inappropriate amount of insulin into their bloodstream.
Exactly, which causes a catastrophic, immediate drop in their blood sugar levels, followed rapidly by liver necrosis or liver failure.
Jeez.
The symptoms of poisoning can vary wildly depending on the toxin. Vomiting, diarrhea, tremors, disorientation. But the real danger is that symptoms often take time to appear. By the time your dog is actively stumbling around, massive internal damage to the kidneys or liver might have already occurred.
Here's where it gets really interesting, though, because there is a paradox here when it comes to poisons in the source text. If a dog eats something toxic, human instinct is to immediately make them throw it back up, right? Get the poison out of the system.
Sure, that makes logical sense.
Right. But the experts specifically say, never induce vomiting at home without a vet's direct guidance. Why? That feels so completely counterintuitive.
It does feel counterintuitive, but it's a vital rule. The reason is that certain toxic substances, like caustic chemicals, bleach, or batteries, will burn the esophagus on the way down.
Oh, no.
Yeah. If you pour hydrogen peroxide down your dog's throat and force them to vomit, you are forcing that highly corrosive chemical backup. You're causing a second round of severe, potentially fatal chemical burns to their throat. Plus, bringing up certain sharp objects can cause tearing on the way out.
That makes total sense when you explain it like that.
Yeah.
So what is the protocol if you walk into the kitchen and catch them eating something they definitely shouldn't?
You immediately call your vet or a dedicated animal poison control hotline. You tell them exactly what the dog ate, and you let the experts tell you whether it is safe to induce vomiting.
Got it.
And crucially, you grab the packaging of whatever they ate or take a clear photo of the ingredients and bring it with you to the clinic. Knowing the exact chemical compound is pure gold to the treating veterinarian.
Right. Don't just guess what was in the peanut butter. Bring the jar.
Bring the jar.
Okay, so we've been talking about internal threats, ingesting toxins, twisting stomachs. But that sudden hidden damage is remarkably similar to how their bodies react to extreme external threats, because temperature and physical impact are massive factors in emergency medicine.
Absolutely. Let's start with temperature. Heat stroke. This is an entirely preventable tragedy, but it's incredibly dangerous. The fundamental issue is that dogs do not cool down the way humans do.
Which is a massive biological disadvantage. We can just sweat across our entire body surface to regulate our core temperature, but they are entirely reliant on panting.
Right. I mean, they have a few sweat glands in their paw pads, but panting is their primary cooling mechanism. And essentially, panting is just trying to cool down a furnace by breathing fast.
They can only do so much.
Exactly. It has a strict breaking point. If they are exercised too hard in the heat or left in a poorly ventilated space, their core body temperature can skyrocket past 106 degrees Fahrenheit, at which point organ tissues literally begin to cook.
Ugh, that's awful. And the signs of heat stroke are very specific. Heavy, labored panting that doesn't stop, stumbling around, confusion. But there's a really interesting visual cue here in the text. Brick red gums.
Yes. Earlier, we talked about pale or blue gums, meaning a lack of oxygen.
Right.
Brick red gums mean the blood vessels have massively dilated. The body is opening the floodgates, sending all the blood to the surface to desperately try to shed heat.
So if you see this, the action plan is to move them to a cool, shaded area immediately.
Okay.
And apply cool water to their armpits and groin where the blood vessels are near the surface. But the rules are very adamant about this. Never use ice.
Never. Rapid overcooling with ice causes those dilated blood vessels to suddenly constrict. It snaps them shut, which actually traps the deadly heat inside the internal organs and causes an entirely new set of severe complications.
Like what?
Well, it can cause severe blood clotting disorders, for one. So you want to use cool, not freezing water, let them drink if they are conscious and can swallow, and get to a vet.
And the absolute golden rule, which honestly cannot be said enough, never, ever leave a dog in a parked car. Not with the windows cracked, not for 5 minutes while you run into the pharmacy.
Well, never.
The interior of a car becomes an oven in a matter of minutes.
It's just never worth the risk. And the math on car temperatures is staggering. It climbs so fast.
Now, moving from temperature to physical trauma, there's a section on eye injuries. And I'll admit, we don't often think of a watery eye as a drop-everything emergency.
We don't, but the structures of the eye can deteriorate astonishingly fast. Oh, yeah. If your dog is suddenly squinting hard, pawing frantically at their face, or if you see deep redness, sudden cloudiness, visible discharge, or God forbid, a puncture that is urgent, certain injuries, like deep corneal ulcers or spikes in eye pressure from glaucoma, can lead to permanent vision loss in a matter of hours.
Wow. And the rule here is do not play doctor. Do not grab human eye drops or try to flush the eye out yourself. Cover it loosely, maybe with a clean, soft cloth, just to stop them from scratching it and making it worse, and get to the vet.
Exactly. Just protect it and go.
Yeah.
Which brings us to the broader category of trauma. Car accidents, big falls, or fights with other animals.
Now, this part really stood out to me.
Yeah.
Because we've all heard stories where a dog gets clipped by a car, they roll over, pop right up, trot away, and look completely 100% fine.
Yeah.
And the owner thinks, wow, we got so lucky. And then 30 minutes later, the dog completely crashes.
Because of adrenaline.
It's just like a human athlete. You hear these wild stories of a football player finishing a championship game and then taking off their cleat in the locker room and suddenly realizing their foot is broken in 3 places. The adrenaline completely masks the pain.
It is a profound biological override. In the moment of trauma, their system floods with adrenaline and cortisol, masking immense pain and even masking the subtle symptoms of internal bleeding.
Which is why they look fine.
Right. That's why the absolute rule is, after any significant physical trauma, they must be evaluated by a vet, regardless of how normal they seem in those first few minutes. You have to assume they are hiding something.
And there is an incredibly practical tip in the notes for dealing with an injured dog. When they are in immense pain, even the sweetest, most gentle golden retriever might snap or bite you.
Oh, absolutely.
It is not aggression. It's pure blind survival instinct. So it's recommended to use a towel or a blanket as a makeshift muzzle when you are lifting or moving an injured dog. It protects you from a bite, which ultimately allows you to safely help them.
It's a vital safety measure. You cannot help your dog if you are bleeding from a bite wound. And, knowing all this medical science is really only half the battle.
Right.
Because if you panic, none of this matters. The final piece of the puzzle is how you manage yourself in the chaos of that moment.
Yes, becoming the ultimate advocate for your dog. And a huge part of that is emotional regulation. Dogs are basically olfactory and emotional sponges.
They really are.
They can literally smell the stress, sweat, and cortisol we produce when we panic. If you are screaming and crying, they pick up on that immediately, and it actively adds to their psychological stress, which makes their heart rate spike, which makes the internal bleeding or the oxygen deprivation worse.
You have to manufacture calm. Take a deep breath and focus entirely on the logistics, getting them safely into the car, having someone else drive so you can sit in the back with them.
Yeah.
And a very tangible step you can take today, right now, while you're listening, save your regular vet's number, the nearest 24-hour emergency clinic, and the animal poison control hotline in your phone's contacts.
Not when you need them. Now, so what does this all mean? The material spends some time talking about this specific app called VitalPet. And honestly, I have to play the skeptic here.
Sure.
In the middle of a literal life or death emergency, is fiddling around with a smartphone app really going to save my dog's life? It feels a little bit like a tech gimmick.
It's completely fair to be skeptical. And it's important to clarify what the app actually does. It is strictly an objective tool for the triage and intake process.
Okay, how so?
When you burst through the doors of an emergency room with a dog in crisis, the veterinary staff is going to fire rapid questions at you. What milligrams of heart medication are they taking? Are they up to date on their rabies vaccine? Have they had a history of liver enzyme spiking?
And when you're panicked, your brain just goes blank.
Yeah.
You can't remember what you had for breakfast, let alone the exact name of their monthly tick preventative.
Precisely. The app is just a consolidated digital folder of their medical records, health notes, and vaccine dates. It bypasses your panicked memory and allows you to hand the vet accurate, vital data instantly. Ah, okay.
The experts make it explicitly clear. VitalPet is not a diagnostic tool. It does not replace a doctor. It simply makes you a faster, more organized advocate for your dog at the exact moment the veterinary team needs information to start pushing medications.
Okay, that makes a lot of sense. It's the digital equivalent of having your paperwork in perfect order so the doctors can just get to work.
Exactly.
Which brings us to the absolute biggest takeaway from all of this information today. Your job as a dog owner is not to be a veterinarian. You are not expected to diagnose the physical twisting of the stomach or identify the exact chemical compound of a toxin or treat the thermodynamics of heat stroke.
No, absolutely not. Please don't try.
Your job is simply to notice when something is seriously wrong, when that baseline of normal shifts dramatically, and to safely transport them to the people who can actually help. That is it. You are the observant chauffeur.
If we connect this to the bigger picture, it really makes you think about that adrenaline response we discussed earlier.
Yeah. The way a dog can get hit by a car and just trot away, completely masking their pain for 30 minutes, it raises this truly amazing evolutionary question. How much of our dog's instinct to hide their vulnerability stems directly from their ancient wolf ancestors?
Oh, wow. That's fascinating.
Right. I mean, in the wild, appearing weak, limping, or showing illness in a pack could mean being left behind, or becoming an easy target for a larger predator. Hiding pain was literally a matter of survival.
There was life or death.
Exactly. And it really makes you wonder, knowing how deeply wired they are at a DNA level to appear strong, what other subtle signs of daily discomfort are our dogs bravely hiding from us right now just to keep up appearances?
Wow. That completely changes how you look at them when they're just lying on the rug. They're so tough, so resilient. And because of that ancient instinct, they rely entirely on us to be their voice and their advocates.
We just have to pay attention to the subtle shifts.
Thank you so much for joining us for this deep dive. We hope you feel a little more equipped, a little more empowered, and ready to be that fire extinguisher for your best friend. Keep exploring the fascinating world of animal health, and we will catch you on the next one.